Well, colleagues, very good morning to all of you. I think it's important for us to get going exactly on time. A very special word of welcome to the Chief Inspector of Mines and Mr. David Msiza and our DMRE colleagues that are also on the call, to other senior government officials involved in the discussion today, our leaders from organised labour, who've also been playing a remarkable role in this particular area. Our fellow CEOs, fellow office bearers of the Minerals Council, the President of the Minerals Council, and the other office bearers, CEOs, members of the media, Minerals Council colleagues and other guests. A very good morning to all of you, and really appreciate your attendance at today's session. As much as it is a virtual session, it's still extremely important. What I'd like to ask all of you to do, if you don't mind, is to put yourselves onto mute. Anyone who's speaking or not talking, and those that do talk, if you don't mind, going onto camera also, so people can see, whoever's giving an input at this particular stage. So, colleagues, what I'm going to do is I'm going to give a quick set of introductory remarks, and then I'm going to hand across to the Chief Inspector of Mines, who's going to give us an input, about a 10-minute input. From there, we'll hand across to Ms. Nolita Fakordi, the Minerals Council President. And then we'll go through to Mr. Temba Mkonazi, also a fellow office bearer of Nolita's, as a Vice President of the Minerals Council, but he also chairs the CEO Zero Harm Leadership team. And then 11:30, we'll have some messages from organised labour representatives, a number who are on the call. A couple of them have to be pre-recorded because of a bit of a clash in terms of diaries. And then a quick close from myself, and then we'll go straight into a media session at about 11:55. So quick summary of today's proceedings. I'm going to be the Master of Ceremonies, and what I'll ask is Charmaine will help handle the media session at the end of this particular program. So I welcome you today to this annual National Health and Safety Day in Mining. It's become a tradition. It's rooted in the history of our Kumbulikaya campaign, initiated to remind us all, and particularly the leadership of our industry, of the need to maintain an intense focus on the safety and health of our employees. Any measure of the effectiveness and progress of our industry must look at progress towards ensuring that every employee returns home as healthily and safely as they left home to head for their workplaces in the morning. In particular, we cannot countenance deaths of colleagues as a consequence of an accident or occupational health incident at work. And while we have made significant progress towards meeting that goal, we know we still are a long way away from achieving it. And as others have detailed shortly, we have seen a regression that we need to address very firmly. And you'll see that there are some significant collaborations amongst all the different stakeholders on looking at particular solutions. The last 18 months have confronted us with an additional and most profound health challenge. And I'd like to thank everyone present for the remarkable role that you all have played in saving lives and saving livelihoods. Government, organised labour, and the industry, every single worker. The heroes of this pandemic are the people that have been in the front line, going to work every day to keep South Africa's economy going and to keep us all safe from a frontline healthcare perspective. Before continuing, what I would like to ask all of you to do is to observe a 1 minute of silence for those who have passed away in the industry. So far this year, we've lost 32 colleagues, and in the last 18 months since the beginning of last year, that is 92 people who have succumbed to injuries sustained in mine accidents since the beginning of 2020. And I think we must also remember the 472 people who have become victims of COVID since the pandemic began. So without further ado, if we could just focus on 1 minute of silence, please. Thank you.
You're muted, Roger.
You're on mute, Roger.
I'm not sure who put me on mute, but whoever did, please don't do that again. So colleagues, we mourn their loss. Appreciate you taking that minute of silence. We mourn their loss and we recognize the pain of the families that have lost their loved ones. And in the midst of the sadness, there is, I believe, a real glimmer of hope. And we have, as an industry, done a remarkable job in working together through collaborative partnerships to protect our employees from the ravages of COVID-19 as far as this has been practically possible, working hard to save lives and to save livelihoods, and we will continue with this. But the way forward for us as an industry and as a country is to achieve community immunity through vaccination. And I've got to say, when we look at the numbers from the rest of the world, if you look at last week in the United States, 99% of new COVID cases in the United States are in people that are unvaccinated. So with the National Department of Health and the trade unions, we have embarked now on a truly groundbreaking endeavor that will help save many hundreds of lives that the pandemic would have otherwise taken. I talk here about the mining industry's contribution to the national vaccine rollout. To date, 58 mining occupational health sites have applied to register as primary vaccination sites. A number of others will operate as secondary sites. And our goal is to ensure that all employees are able to be vaccinated as soon as national policy and the availability of vaccines makes it possible. What I will say is the criticality of government helping us to, I wouldn't say regulation light, but to for the registration of these occupational health sites to see how we can compress the process to get as many of our sites registered as quickly as possible so that when the vaccines do become available, you know, we are able to get out there and really do what we want to do, which is to help the nation. 6 sites have already begun vaccinating. Another 8 will begin shortly, and we're working closely with the National Department of Health to expedite the registration process in terms of mining sites as soon as possible. In fact, we are seconding some staff members into a process to accelerate the registration of these sites. So subject to National Department of Health approvals, some mine vaccination sites may extend their services to employees' families and others in the surrounding communities, or provide support to community vaccination programs. And I think this is really important. I just hope that all our sites are actually opened up for this particular purpose, because as we said before, this is all about how we get the nation vaccinated. And as mining, we want to play our role, and this is truly a critical endeavor. I appeal to us all, my fellow industry leaders, our leaders in the trade union movement, our leaders from the Mine Health and Safety Council perspective, and from the DMRE and from the National Department of Health, to do all that is possible to persuade those who doubt the efficacy of vaccination programs that they and their families' interests will be best served by being vaccinated at the earliest opportunity. I mean, what person wouldn't allow their child, for example, to be vaccinated against mumps, measles, and rubella, the so-called MMR jab? I think this is exactly the same. So we must ensure that all employees have the time and opportunity to take those opportunities for vaccination that will come as the vaccinations are made available to us through the government program. So, ladies and gentlemen, I thank you all. Really appreciate you attending, and I'd like to invite the Chief Inspector of Mines, Mr. David Msiza, to address us. David, over to you. Thank you very much.
Thank you, Roger, for the opportunity for the department to address this occasion. It's for us, it is a great pleasure to always participate in such occasions. But I think it's also important for me to make some few acknowledgements before we proceed with the message that we want to pass today. I would like to acknowledge Ms. Nolita Fagude, the President of the Minerals Council, Mr. Themba Mkhwanazi, the Chair of the Minerals Council CEO Forum, yourself, Mr. Baxter, the CEO of the Minerals Council, all the CEOs and managers in attendance today, the leadership of organized labor who are also in attendance today, my colleagues from the Department of Minerals and Energy, and from the Mine Health and Safety Council, the media who's present here today. Ladies and gentlemen, good morning once Good morning once again. I think this occasion, I think for us, once again, we'd like to commend the Minerals Council for always arranging these type of occasions, because it gives us an opportunity to reflect and say together what can we do to ensure that we ultimately achieve the goal of zero harm on the mine workers and all the people who are affected by the mining activities. Mr. Baxter has also touched on COVID-19, which has heavily affected all of us, including the mining sector. We as a department, firstly, through the leadership of the minister, we've been continuously engaging with the sector, including Minerals Council, organized labor, on what measures should be implemented since the beginning to ensure that we safeguard the lives of the mine workers. We came up with the guiding principles to assist the sector to come up with risk-based protocols. We also came up with a guideline which we worked together with the sector on prevention and mitigation of COVID-19 in the sector. I think it was very important that we do that so that there should be a standard approach throughout the sector in dealing with the issues of COVID. As Mr. Baxter has indicated, through this, I think we've made a huge impact in the sector and also in protecting the lives of the mine workers and also the affected people who are associated with mining. We have never stopped as a department. We've also been doing inspections and audits, monitoring compliance with the legislation that I've referred to. In fact, by the end of December last year, since the lockdown level 5, we've done more than 6,000 inspections and audits to ensure that appropriate interventions are put in place. On the occupational health and safety front, for us, as we previously indicated, the health and safety of the mine workers continue to be a priority for the government. Hence, various pieces of legislation were enacted to address challenges relating to the occupational health and safety performance in the mining sector. As government has been working with all stakeholders in the sector to vigorously support and promote and entrench a culture of zero harm. The department has taken a strong stance on mining health and safety and will continue working to realize its commitment towards promoting and improving the health and safety of the mine workers and the affected people who are associated with mining. Working under harsh and disastrous conditions imposed by COVID-19, we still believe that zero harm is possible. The theme of today is renewed focus for a new normal. A new normal is a current situation, social custom, etc., and that is different from what has been experienced or done before, but is expected to become usual and typical for us in the mining sector. Our routines are changing as our lives are upheaved by the changes brought by COVID-19. To discover more about what the new normal means for the mining industry, we must look at how our employees are adapting to all the conditions that are brought about by regulations, protocols, changed schedule of work, isolation and lockdown, as well as how the vulnerable employees are cared for in the industry. Not forgetting the physical and mental needs that are rising as a result. The most important thing to note is that the current situation is not a marketing opportunity. The critical thing to do right now is to renew our focus on how we shall continue doing our work in a productive manner, which will be sustainable, start to shift to the new paradigm of work to build resilience and flexibility for operations and the workforce, and speak to people in a way that meets some of their expectations. Rebounding operations is about finding and adopting creative solutions so that operational continuity can be maintained. For example, minimizing worker movement and exposure between sites, tracking and monitoring contractors, assessing jobs and identifying necessary skills, and focusing on scheduling and planning flexibility will all help keep people in the workplace and maintain production in a tight economic period. Realizing that the COVID-19 crisis has heightened the need for companies to put employee health and safety first, and many organizations responded by protecting their workforce, has to be commended. And as indicated, we really commend all of us, including the organized labor, to make sure that we focus on this particular matter. Prior to the arrival of COVID-19, working with mining companies, organized labor, the department made significant strides in improving the health and safety for the mine employees. This led to the sustainable downward trend in occupational diseases, injuries, and fatalities over the years. Occupational health and safety statistics show that 2019 remained the safest year ever, with the lowest fatalities, injuries, and occupational diseases ever recorded. On the occupational health matters side, the biggest challenges that we have been identified, especially last year, is that we have not, some of the mines have not been reporting in terms of the requirement or the occupational health incidents. So we'll really will require and request the sector to continuously report these statistics to us, because they do help in making sure that we monitor the trends and we share the same information with yourselves. However, from the information that we have assessed, that we've received in the sector, we've seen significant reduction in the occupational health incidents and occupational diseases that have been reported for the 3 quarters for last year as well, and also coming up to date. We've seen a significant reduction in occupational diseases. However, we're still concerned that pulmonary TB and nose-induced hearing loss remain a worrisome concern, particularly in the gold, platinum, and the coal sectors. Silicosis is still of great concern for us, especially in the gold sector, with crystalline silica as most prevalent. The 6 silicosis novice cases from the gold mines require an in-depth investigation as required by Section 11 of the Mine Health and Safety Act. In terms of occupational safety, there was a 26% reduction on mine injuries reported last year, with a total of 1,814 injuries compared to 2,452 reported during 2019. However, it is still regrettable that on our journey towards zero harm, a total of 60 fatalities were reported by the sector in 2020. An increase in fatalities during 2020 is extremely disappointing and is not a regression that we can easily accept, but instead has resulted in more intensive introspection on root causes and is receiving our full attention. Fall of ground accidents, including seismicity, remain a significant challenge in the platinum and the gold sectors, especially at our deep level mining operations, whilst transport-related accidents continue to mostly affect the coal and the platinum sectors. It is also worth noting that regression on fatalities and injuries has been noted during the first half of this year. The latest statistics show that already the mining industry has reported 32 fatalities, as Mr. Baxter has indicated. Fatalities so far during 2021 include a total of 4 mine deaths classified under the category of miscellaneous. Miscellaneous accidents are those that we could not determine what has been the cause of these accidents. In this regard, we really would like to appreciate and request the sector to continuously, timely assist us in investigating these cases, and so that we can make sure that we determine what are the major causes and take a prompt action to deal with them. There has also been 57% increase on injuries for up to date. And we also appreciate, although this could also be attributed by the impact of COVID-19, in that the mines have not been fully working last year. However, as a department, we are greatly concerned that we still experience these accidents. We'll continue to offer our solidarity and support to alleviate the agony of loss of the families who remain. We remain steadfast in our goal of attaining the goal of zero harm in the sector and call on all stakeholders to work with us in protecting our most valuable resource, our fellow mine workers, who are responsible for turning the mining company's investment into wealth, which ultimately grows and develops our economy. In this regard, the department has been engaging with the company CEOs. We've also engaged with the Minerals Council Board to make a reflection to say, given this dynamics and the challenges that we've been facing, especially since last year, how do we work together in making sure that we balance between COVID-19 and also occupational health and safety measures. And I must say that we appreciate the constructive nature of the engagements that we've had. We've had engagements where the CEOs has indicated to us what are the key challenges that they are experiencing and what are the key strategies and interventions that will be implemented to reverse the current situation. So as a department, we will continuously engage with the sector, including organized labor, because we believe that it's a collective effort to ultimately achieve the goal of zero harm. We also would like to encourage all the companies to continuously work together with organized labor, because sometimes we do receive complaints as well from organized labor that their participation is not noted as it should. And we really, once again, encourage the sector to also work together with organized labor at the mines themselves. The health and safety of the mine workers is everyone's responsibility. Working together, we can attain the goal of zero harm in the sector, while also keeping in mind that the long-term sustainability of mining is dependent not only on its growth, competitiveness, and transformation, but also on how well its workforce is cared for. We once again, as a department, would like to thank you for the opportunity to address you during this occasion. Thank you.
Chief Inspector David Msiza, thanks very much, David. Really appreciate those very insightful words and focal points. I think a number that came out there: continued focus, continued leadership collaboration, looking at solutions, and continuing this really critical journey towards zero harm. So thanks very much for those words, and certainly the commitment is there from our side, and I know it's there also from the organized labor side. So let me immediately hand over to Ms. Nolita Fokodi. She is the President of the Minerals Council South Africa. Nolita, I'm not going to say any words of introduction. You are very well known, and let me not detract from the time that you'll have on your speech side. So let me hand straight across to you. Nolita, thank you.
Thank you, Roger, and thank you very much for holding and setting up the scene. Chief Inspector of Mines, Mr. David Msiza, leaders of organized labor from the various organizations represented this morning, senior government officials with us at this platform, office bearers and board members of the Minerals Council, the CEO of Minerals Council and the team at the office, Roger, and your team, other companies represented, as well as members of the media. Good morning and welcome to the 4th Annual National Day of Health and Safety in Mining. This is the most important day in our calendar as the Minerals Council, so thank you very much for attending. In 2018, when we launched and earmarked this day as the National Day dedicated by us all to recommitting ourselves to do more and better on matters of health and safety as the mining industry, we never could have imagined that 2 years later, in 2020, we would be faced with a global health pandemic called COVID-19. It's now almost 18 months later, and we still find ourselves in the middle of this pandemic, and as a country facing what is referred to as a third wave, a wave that has been vicious in its destruction of how we have come to experience our daily lives. As an industry, our response to this pandemic in 2020 brought to the fore our safety instincts that we always have held up as our foundation and fundamental value. The mining's response was comprehensive, including securing business continuity, protecting colleagues' lives, extending relief support to host communities, as well as partnering with stakeholders like labor, other business associations, governments, both at local and national level, to ensure that we not only pushed back the wave of infections threatening our lives at the time, but also strived to safeguard livelihoods. Our adoption of the SOPs and the 10 principles of COVID response, as Chief Msiza has indicated, went a long way to ensure that the industry had common protocols and guidance to go through this period. We thank the DMRE leadership led by Minister Mantashe, as well as yourself, Chief Director Msiza, and your team, as well as all of our labor partners for this collective effort. However, the health pandemic has been relentless in its spread, and the third wave has engulfed most of our country, severely affecting both lives and impacting livelihoods. We know that for any safety campaign to succeed, there has to be confidence in both the physical and psychological security. These two provide peace of mind as well as greater well-being, and COVID is eroding both, and that's the reality of our new normal. As we have noted in other countries, early access to vaccines have had a significant effect in limiting the harsh impacts of this pandemic, and as well helped them get back sooner on the road of recovery and economic recovery. This is also a path that we as South Africans desire for ourselves. Meanwhile, we have to continue to strictly adhere to the non-pharmaceutical interventions that rely greatly on human behavior and discipline. As the vaccine rollout unfolds in the country, we know that as an industry that we will once again be in a position to support the government's efforts to reach as many people as possible within the capacity and health infrastructure that we have in mining. Unfortunately, we know that due to the physical and mental fatigue, largely as a result of the COVID health pandemic, our members' safety and health numbers are regressing. As much as we have done well last year in this regard, we dare not let our guard down. The third wave requires greater vigilance and mindset of safety first in all we do. Chief Director Msiza, in 2020, we unfortunately saw a deterioration in mining safety performance in terms of fatalities. Furthermore, thus far in 2021, we are seeing a worsening of the fatality trend. This is not acceptable to us as the Minerals Council and our members. Today, amongst many issues that we will be focusing on will be about how we continue to hold each other up to support and help boost morale among others during these difficult times. More importantly, and for these reasons, the theme of today's event is a renewed focus for our new normal. As we reboot our commitment to ourselves to keep that promise of ensuring that everyone works safe and feels safe when they are at work, so that at the end of the day, they can go back home safe to their loved ones. That's the spirit of Khumbule Ekhaya, and that will remain our key focus. All that Khumbule Ekhaya stands for still remains valid, including the prevention of fatalities as our primary focus, the need to integrate health and safety, and the need for intensified vigilance and effort. The new normal is about resilience, and we will work through our continuous commitment to collaborations between companies, unions, and the DMRE. We are in this together. I'm grateful to everyone who continues to make these commitments become a daily reality. Thank you to the CEO Zero Harm Forum, led by Themba Mkhwanazi, our Vice President of the Council, and the many, many colleagues, also led by Roger Baxter from the Minerals Council, as well as from other companies. Your dedication inspires us to do better. while wishing you all fruitful and meaningful engagements for today. And may we continue to stay vigilant in observing the industry's safety standards, especially during this time. Keep safe and stay strong. I thank you.
Nolita, thanks very much indeed, and for taking the time out of your busy, very busy schedule, really demonstrating leadership from the front, and real heartfelt leadership. So Nolita, thanks very much, and let me hand over straight away to Themba Mkhwanazi. As Nolita indicated, he is the chair of our CEO Zero Harm Forum, and also vice president at the Minerals Council. And Themba, you've also been one of the most incredible, heartfelt leaders in this particular conversation. So let me hand straight to you. Thank you.
Thank you, thank you, Roger. I too would also acknowledge Mr. David Msiza, the Chief Inspector, and also the Mine Health and Safety Council Chair. Also, our President, Sis Nolita Fagude. Also our fellow office bearers, vice presidents of the Minerals Council, Roger Baxter, our CEO, and also the various teams in the Minerals Council, all of our unions on the call, our peer mining companies and members and CEOs, and also the media who are also on the call. Good morning, ladies and gentlemen. It is truly a great opportunity on this very important day in our calendar of the National Day of Health and Safety. I will be showing a presentation, so can I please ask that the presentation is uploaded? We are not quite seeing it at the moment. I've also noted as well that there's quite a number of people that are battling to connect, particularly on the mobile platforms. So we are looking into it, and we would like to ensure that we get you on the line as soon as possible. So our sincerest apologies for that. Are we good to go on the presentation?
Themba, we can certainly see it on this side.
Okay, well, I can't see it on my side. But anyway, nonetheless, it's fine. Let's continue. So the first slide, I mean, this is for us what Khumbule Khaya is all about. You have a dad, could be a mother, and the two children, and clearly a mine worker, a colleague of ours, going to work. And when you look at the visual and you look at the children, that for us represents hope, that for us represents security, that for us represents progress from the context of daddy is going to work, but there has to be the promise that, you know, daddy has to come back to work in the same way that he left on the day. And that's what Khumbule Khaya is all for us. It's that unwritten code, it's that compact that we have with the families of all of our employees and contractors, that we will return their loved ones each and every day without harm. And that's what Khumbule Khaya is all about. If we move on to the next slide, I think we've heard from Roger, the Chief Inspector, and Sis Nolita around the commitment to zero harm. And again, I just want to, you know, as the CEOs of the mining industry, to reiterate that we remain unwavering in our commitment to zero harm. And our absolute and foremost priority as an industry must be the health and safety of all of our employees and contractors. And so it is with great regrets and clearly a sadness that we have seen a regression in 2021. As has mentioned, 33% with regards to fatalities, and 65% with regards to all injuries. Now, I can assure you that this is front of mind for every mining company CEO and is a major concern for our CEO Zero Harm Forum. You will have noted the Chief Inspector also talking about the conversation that we had with him and his inspectorate, and similarly the conversations that we have also had with our 4 major unions. Now, our industry safety performance in 2019 and the years leading up to it, we saw significant improvement. And in many ways, this was a tribute to the deep and intensive collaboration between all the role players, the companies, the unions, and the DMRE. Significant efforts had gone into the investment in terms of the adoption of standards, certain regulations that were put in place, but also a significant investment in technology. And that's why we saw the improvement. And then again in 2019, we then also as CEOs had a pretty heartfelt conversation and discussion amongst ourselves around what our role was going to be in terms of driving further improvements in terms of safety. And that's the resultant of that was the adoption of the Khumbula Ekhaya strategy. And while we continue with our Khumbula Ekhaya strategy with a focus on this holistic approach to eliminating fatalities as a result of safety and health incidents, the Khumbula Ekhaya program broadened to encompass COVID-19, as you have heard from our president, including what we need to do to keep every employee and their families and communities safe. Now, on the third slide, we are as partners in this, all on the same boat. And I use the analogy of the canoe that says, as the DMRE, as the unions, as the mining companies which are represented under the Minerals Council, we are in a canoe. The challenge we have at the moment as a consequence of the regression is that the canoe is in white water, in rapids. It has hit rocks and there's a hole in it. And what we need to do now is to ensure that we steer the canoe to safer waters so that we can fix the hole in the canoe to continue on our journey of elimination of fatalities. Now, what's important about that, though, is that we all have to work together. We cannot have people on the canoe pointing fingers at each other, because if we don't work together, then we will sink in the rapids, in that white water. So if we move on to slide number 4, when we look back, though, particularly, as far back as what you can see on the slide there, you can clearly see that the improvements achieved in safety over the years leading to 2019 were pleasing and were achieved through a concerted collaboration effort between all of us, companies, unions, and the DMRE. But as I've mentioned, we have seen the regression in 2021. And this is despite, the shutdown and reduced operations during the early stages of the lockdown that we saw in 2020. So in 2020, there was an 18% reduction vis-a-vis 2021, where we had 60 fatalities versus the 51 in 2019. And this regression was in all the commodities except platinum, which showed the improvement. And sadly, this year, we've had 32 fatalities, compared to 24 during the same period in 2020. And the gold sector has been the most affected with 15 fatalities, followed by platinum with 7 fatalities, and coal with 5 fatalities, and other commodities with 5 fatalities. With regards to total injuries, our journey of collaboration has been more remarkable, as you can see in slide number 5 that's showing at the moment. The industry recorded a 26% improvement in overall injuries from 2,452 in 2019 to 1,814 in 2020. And this reduction in injuries is the highest improvement recorded in the last 5 years, above the annual milestone reduction of 20%. Now, some of you might well say, well, that's also because maybe there was a contribution there of maybe fewer hours being worked because mines were not fully operational. But again, you know, we need to take that into account, but we also need to acknowledge the improvement. Sadly, we talked about earlier the regression. If we move on to slide number 6, and this really is around our underpinning our Khumbule Khaya strategy, is a need to focus on eliminating fatalities. So it stands to reason that the primary cause of fatalities will determine our priorities. Now, we are seeing effectively 3 areas where we are most challenged with regards to the fatalities. The one being fall of ground, which have been a significant challenge in the platinum and the gold sectors. The second one being the transport-related accidents, and mostly in coal and platinum sectors, as the Chief Inspector has already alluded to. And then the general types of accidents, which have become a concern. The Chief Inspector, you know, talked about the spike in these miscellaneous related fatalities. And again, you know, these are instances where our colleagues, you know, have died when they've collapsed at work for no immediate or apparent reason. Clearly, this calls for vigilance on employee wellness and health in the face of COVID-19. But I'd like to confirm to you, Chief Inspector, that this is a particular issue that we are looking into in a lot of detail. And we're really committed to getting a sense of what's really happening in this area because of the concern that we have. We also do need to also recognize that the impact of COVID-19, particularly on mental well-being, I mean, we call it COVID fatigue, has had an impact on safety performance. When, as most of us are in bereavement, seeing the loss of loved ones, family, colleagues, and friends, and also having to deal with people being sick, that plays on the mind and it plays on the emotional, psychological, and mental well-being of each and every one of us. And again, we have seen a contribution to this, to some of the incidents that we have had on the workplace. So that's why, again, you know, there's a big focus around mental well-being and how we cope with the environment that we are currently in. And again, you know, yet again, a very good reason why we've really got to push for the vaccination of our society. Moving on to slide number 7. So we've had a regression, you know, what are we doing about this? What are we doing about this unacceptable situation? Well, on falls of ground, I must say that gravity-related rock falls present a larger challenge in comparison to the seismic-related rock bursts. And this is an area where extensive progress has been made in the recent years at the deep-level mining operations. We were extremely challenged with these rock bursts but because of the focus, the commitments by the mining companies, the investments in technology, we've seen a significant improvement in that area. And that obviously encourages in our plight against the broader fall of ground incidents. And I'm also very pleased to report that following much work done on understanding the context and causes of fall of ground, the CEO Zero Harm Forum last week approved an action plan for the elimination of falls of ground. The summary infographic of what this entails, depicted on the right hand of this slide that we are seeing, will be available on the Minerals Council website later today. To succeed, we need collaborative efforts from companies, of unions and the regulator, and various professional bodies and research institutions. And we've achieved a step change in reducing fatalities before. So together we can do it again. And hence my analogy of the canoe. Turning on to slide number 8, I do want to reiterate our continued commitment to the Khumbule Khaya strategy. And again, a key element of the Khumbule Khaya strategy not only focuses on fatalities related to safety, but also to health. Because as we know, the health or the occupational diseases, we don't necessarily see the impacts today. These are impacts that we see 10 years out. And again, we're very pleased to see a reduction, as the Chief Inspector mentioned, in those occupational disease cases. And as far as the Khumbule Khaya strategy is concerned, I do need to remind everyone of key leadership actions that we spoke of and are undertaking as part of our drive to eliminate fatalities and to change behavior and transform our safety culture. In 2019, I mentioned we had the heartfelt conversation with visible leadership commitment through what we call CEO-ship, which is a critical part of every CEO Zero Harm Forum meeting. I remind my colleagues regularly that our first role must be to show up, to be present and part of the sometimes hard conversations about safety and health. CEOs must drive health and safety improvements from the top by sharing successes and challenges. The Minerals Council team has set up a multidisciplinary independent peer review, accident and incident investigation system and analysis project aimed at improving the quality of investigations. We need to actively learn from each other and from our mistakes so that they are not repeated. We are actively engaged in promoting a just culture model of addressing the so-called blame culture in risk management and incidents as well. And again, I'm happy to say that this is a model that we have come to with the collaboration of all of the stakeholders. A just culture accountability model framework is being developed and disseminated for the entire industry. And to concretize the way in which we share and learn from one another, we also have an established learning from incident working group to accelerate learning from incidents, to facilitate better and faster learning from each other, as well as from other industries. Moving on to slide 9. So in closing, we remain committed to our Khumbule Khaya strategy, even though it has been challenged by the COVID-19 pandemic. We know that the weeks and months ahead of us will not be easy as COVID-19 remains with us. But we commit as an industry to give safety and health, and particularly the elimination of fatalities, our renewed and absolute focus, hence our theme for today. We look forward to our ongoing collaboration with the tripartite stakeholders in government and unions to eliminate fatalities and work towards zero harm. We aim to achieve a step change in fall of ground accident reduction and are implementing a special project on trackless mobile machinery, TMMs. And we will continue to focus on our Women in Mining program as an industry imperative with a specific focus on the safety and health of women. We will not be distracted and will continue to focus on health, particularly non-communicable diseases. And in all that we do, we will seek to work smarter, not harder, and ensure that when and where we modernize the way we work, we undertake a just transition. So I thank you for your time today, and I look forward to hearing from our partners in the organized labor. Thank you, Roger.
Themba, thanks very much for your CEO-ship and for your heartfelt leadership, in this particular process. A lot of content, many ideas and specifics on what we're doing to take the processes forward, working in collaboration with our government and Labour colleagues. And so without further ado, I'd like to hand across to our Labour colleagues. I'm going to start with Kalani Bokoloshi from AMCU. Kalani, if it's okay, would you mind coming in and giving us your specific input, please? Thank you.
Thank you very much, Program Director, on behalf of Comrade Bokoloshi.
Gabriel, greetings. Thank you.
Greetings to Mineral Council, Department of Mineral and Energy, Mine Health and Safety Council, Organized Labour Serving at Mine Health and Safety Council. Please allow me to safely say, all protocol observed. I am here to reaffirm AMCO's commitment that we made in 2014 to the 2024 milestone. Unfortunately, some of these undertakings will not be achieved. Martin Luther King, Jr., said, I quote, "The ultimate measure of a man is not where he stands in moments of comfort and convenience, but where he stands at the times of challenge and controversy," close quote. We have witnessed your courage to lead a change as Mineral Council when you stood up in October 2019, launching the Kumbule Kaya, which was graced by the lowest figure in number of fatalities ever experienced in the industry at the end of December 2019. Perhaps it's the time to stood up again and say, member mine, it is not fair that your mines contributed 7 fatalities, a number equal to the total number of fatalities registered by the Rustenburg mines year to date. It is also time for me to support those who refuse dangerous jobs, not to be victimized, and support women in mining initiatives and drives. It's time for me to request that we investigate and coming with KPIs for part-time safety reps and safety reps development. It is time to implement the newly revised health and safety reps training. It is time to empower the safety reps to apply Section 23 of the Mine Health and Safety Act, which is a stop and fix. It is the time to award those safety reps who apply Section 23 of Mine Health and Safety Act, resulting in reductions of Section 54s and 55s of Mine Health and Safety Act. Excellent work by Masoyise ETB. Collaboration is at high maturity level in Masoyise ETB. All participants realize that life comes first. Indeed, we are delighted with Masoyise ETB performance. Excellent work by Mosh, which placed the Mineral Council as best in class in research and analysis of lagging indicators and sharing information in different platforms. Or when you request them to empower your comrades at regional and operational level, they are there for you and planting seeds that makes a difference to branches union leadership. There has been wins in overall implementation of your recommendations, but that cannot be held against you as MOSH. Some people do not know that the role you played over the years directly or indirectly contributed at bringing down the fatalities to 51 in 2019. COVID-19 has interfered with the way you do things. Hence, we see the fatalities trending upwards, meaning there are players who are absent, who were interacting direct with leaders from the face. South African mining industry has not achieved zero fatalities in December 2020, as per our commitment for the 2024 milestone. That worries us. The most thing that worries us is that 60 lives lost in 2020 is more than 51 lives lost in 2019. Happening at the time where some of the mines' production was halted from midnight 26 March 2020, and mines granted permission to operate at 50% mid-April until granted 100% in May. To conclude and say, the agony of COVID-19 has contributed to the increase of fatal incidents in 2020, should be read together with causations of these fatal accidents, and not leaving behind learnings from previous occurrences before COVID-19, which will indicate that the agencies which were taking a lead in the causation of fatalities before COVID-19 are still spawning. Subsequent to in-local inspection, which are led by DMR Inspectorate, operation discipline remains a big concern, pointing a gap in the obligation of ensuring safety. In closing, we are on the third wave. Let us adhere to non-pharmaceutical health and safety protocols until all mine workers are vaccinated. I am thanking you.
Gabriel, thanks very much for those very clear words from the AMCU side, and certainly lots of recognition of progress made in areas, but also recognition of gaps that are in place that we need to fill and work on. And I think certainly it's a very big focal point of ours. So fully agree with the concept that we absolutely have to continue focusing on the non-pharmaceutical interventions until such time as the vaccines are rolled out. And it's our commitment to do that as quickly as possible, as the vaccines become available to us from the National Department of Health. So thank you for those words. Let me hand immediately over to Mzwakhe Mlapo from the NUM. Mzwakhe, can I ask you to give your input, please? Thank you. Mzwakhe, are you coming in there? There we go. Thank you.
Good
Welcome.
morning. My video is on, but I can't see myself. I don't know if anyone can see me.
We're not seeing you. Obviously, your camera's off, but go for it. No problem. Yeah,
my camera is on,
okay.
On my side, but in the interest of time, Program Director, kindly allow me to make the input and not waste it with the video. I'm not sure what's happening. Let me start by first greetings to all the honorable members that are on the platform. Greetings to yourself, Honorable Director, the Honorable Mamu Fakute, Babu Mkwanazi, and all your executives at various positions that will be held within the Minerals Council, and the mine captains and your executives and your teams at various points of operations, the Mines Health and Safety Council executive and the team, the DMRE team, as led by the Honorable Minister in absentia and Babu Msiza, the honorable leadership of the unions that are in attendance here, and all the stakeholders and principals and partners at various pockets of collaboration on health and safety in the mines. I bring revolutionary greetings from the National Union of Mine Workers leadership in this platform. Firstly, Program Director, we want to appreciate the invite to NUM to submit our thinking and our few thoughts in terms of the commemoration of Health and Safety Day of Minerals Council of South Africa. And indeed, the theme of today, renewed focus on our new normal. It is very precise in the current circumstances that we find ourselves in. And we need to really ask ourselves, Program Director, when we say renewed focus on our new normal, is it going to be a new normal that is informed by COVID? Or is it a new normal where we say we respond to the historical challenges as much as we respond to COVID? Because it is important that we did not only be seen to be responding to COVID when there has been historical challenges, which in some cases, as a mining sector, we have effectively responded to, and we were on the journey of responding to some. Program Director, I will not be repetitious in terms of what our stakeholders have raised, but allow me to say I fully concur with the challenges. We seem to have similar challenges that we have identified. Ubaba Mkhwanazi, Mamu Fakute have taken us on some of the challenges from the Minerals Council's view, and those are the challenges from the National Union of Mine Workers leadership's view. And certainly the challenges as posed by Comrade Gabriel. And I'm certain that even the other unions, it will be somehow similar. So I will not be repetitious. But what is critical is how do we respond to these challenges? And because there's an overwhelm of challenges, I will address these challenges into two areas. The first area, I will call it within the scope of the culture transformation framework, because if you look at the pillars of the culture transformation framework, they address all the pockets of challenges that we have in the South African mining industry. You talk about leadership is there. You talk about risk management, moving away from how we investigate, how we do our risk assessment, our hazard identification and so forth is there. Diversity management in terms of women issues, how do we address challenges of women is there. The issue of building capacity through training is there. So our first point of departure, and where we must not lose the eye as the South African mining industry in the view of National Union of Mine Workers, is that the culture transformation framework, it needs to be our Bible. It needs to be revived. We seem to have lost the traction of the culture transformation framework, and honestly, not because of COVID. It may have added further down the line, but the traction was lost before COVID. For instance, Program Director, the culture transformation framework template for reporting by the mines, as stakeholders, all of us, we have dropped the ball, and it is important that we relook at the culture transformation because it will also assist us to respond to COVID times to some extent. Because when you look at training, you will say, how do you build capacity of your leadership, a GM, a supervisor, an engineer, a health and safety rep, a shop steward, an ordinary worker at the operation under these COVID times? How do we renew that focus? Through training. How do we renew that focus? Through leadership. And therefore, that's why we consider culture transformation as being cornerstone for us to be able to respond to some of the challenges. Program Director, the pockets, the three challenges as presented by Minerals Council, we agreed to them. And for instance, fall of ground. we had committed that we will come up with an accredited training working with MQA, where we will have Seismicity 101 course accredited in the mining industry. Let us relook at that, because fall of ground seismicity continue to be a challenge to us. How can we build capacity at all levels? CEO, GM, supervisor, health and safety rep, shop steward, and an ordinary mine worker, to understand how to respond under the conditions where seismicity occurs. And how do you exercise the rights that Comrade Gabriel has referred to, which we are very passionate as a union in terms of those rights. Program Director, we will not leave this platform without appealing to our partners that are herein. The Mines Health and Safety Council represents us. It represents the three pillars of sphere of partnership in the mining: the state, organized business, and organized labor. If that entity collapses, or it does not perform, or we lose faith as stakeholders in that entity, we will have failed ourselves. We will have failed the mine workers. We will have failed the constitutional right of the mine workers. So our appeal, Program Director, is that as partners, let us stand up, let us rise up to the challenges that are facing that institute and revive that institute. We need to bring back the credibility of that institute so that the collaborative work in transforming health and safety agenda in South African mines can be realized for us to achieve zero harm. Ubabu Nkosi has spoken about building capacity for health and safety reps. That is very critical. There's a project that is happening at Mine Safety Council. We are not happy with the progress that is progressing as done by vets. And we want Mine Health and Safety Council to relook into that. It's been going on for too long, and there are some challenges. As NUM, we are not happy at all. So we once wrote in collaboration with Minerals Council when you were still Chamber of Mines. We wrote to Mine Health Safety Council as organized labor and Minerals Council to raise our dissatisfaction about the delivery of the training of health and safety reps and shop stewards. Until we deal with the bottlenecks and the progression of training of workers, it must not be a once-off thing. We will not be able to realize the benefits of training. Program Director, there's so many things I can talk about, but I've tried to gallop in the very little time, noting that we have gone over time. So please allow me for now to pause at this point. We will continue to engage, but I will not close without having applauded the Mineral Council for setting up these engagements. It is when you see the trend as it's scary. We are sitting at 32 fatalities by the 5th of July, as opposed to 24 last year, same period. Obviously, as Mineral Council, you demonstrated leadership and you said, no, this can't be right. We need to have engagements. Please let us continue to engage to find solutions, not just to engage. And perhaps it might be good, Program Director, that these platforms of this nature, because now we are doing them virtually, the workers themselves, they become part of this. They may not participate, the leadership will participate, but these engagements are projected at the operations where it's possible, where there are TVs, so that the workers can listen when the Minerals Council leadership commits itself. The general manager can listen when the vice president or the president of MINCOSA commits themselves. But equally, they can hear that their unions, what issues are they raising, so that they don't think that we are resting on our laurels. And equally, they can hear the commitments from the regulator, in this case, which is the DMRE. With those few words, Program Director, thank you so much for the opportunity. We would like to continue to reiterate our support for vaccination of the workers. However, we want to caution that we must not look at vaccination as the sole solution. There is a threat of a fourth wave, with a strain that there is suspicion that it may not, the vaccination may not be sufficient to deal with that strain. So all that is telling us is that our behavior is very much critical. Our behavior in how we approach using the protocols that have been referred to by Comrade Gabriel, but also mining industry has an opportunity to assist beyond what it's doing. And we appreciate the fact that there are mining companies that have started to vaccinate. They've been given licenses. We request mining companies to look as to how can you assist providing infrastructure support and equipment support, because as we know, the hospitals are overwhelmed. There is not enough oxygen equipment to assist. Apparently, there will be a group of recently graduated doctors that are supposed to go on intern that will be brought to manage COVID wards. But if these numbers come and there is no wards, it's a problem. So the mining industry, can you look into your historical buildings that you don't use, see what resources you can provide to those historical buildings so that they may be used as COVID sites. Thank you very much, sir.
Zwaki, thanks very much, and very specific points. Thank you very much for that input from the NUM side. And just to make the point, collaboration and leadership is critical because safety is not a competitiveness issue. Health is not a competitiveness issue. It's about us on this journey together, getting to the nirvana that we're looking for on zero harm. So thanks for that contribution. You'll notice that I haven't cut off any of the speakers, ladies and gentlemen, and I do apologize. It's not because I'm being a bad chairperson or master of ceremonies. It's because health and safety is so important that when people need to talk about the issue, you've got to let them talk about the issue. It's so I haven't deliberately not cut anyone off, to hear exactly what our trade union partners and government and others are saying. So without further ado, let me hand across to Paul Marden from Solidarity. Paul, over to you. Thank you. So Rion, we're not hearing any sound at the moment. I don't know about you colleagues, but I'm not hearing anything.
All silent on this side.
Nothing. We're not hearing a thing.
We're not hearing Rian, sorry.
Apologies. It is set to include a sound. Let me just retry again.
Okay, please.
Morning, I'm Paul Marden, Deputy General Secretary at Solidarity. We live in challenging times and it's therefore particularly special for Solidarity to be able to meet with you in the midst of the biggest health and safety challenge in modern history, the COVID-19 pandemic, and to support the Minerals Council's recommitment to the health and safety milestones and zero harm. Underpinning this recommitment is an honest belief that health and safety at work is the foundation for the sustainability of mining in South Africa. On the long run, only safe production is sustainable. We are appreciative of the Minerals Council's leadership role in health and safety. We believe that leadership is an indispensable requirement for both health and safety and business success. Leadership results in an ethical culture, good performance, effective control, legitimacy, a reputation as a good corporate citizen, market and investor confidence, maximize production and minimal operating losses, sound relations with all stakeholders, including employees, organized labor and the government, and sustainable environmental management. The ISO 45001 standard confirms that leadership and leadership's commitment are central in the achievement of and management of health and safety at the workplace. It recognizes that an organization can improve the health and safety culture by providing clear and consistent leadership, promoting the formal and informal involvement of workers, and ensuring that controls are practical and proportionate to the risks. This in turn will lead to the achievement of the company's operational and economic objectives and goals, and the welfare of the employees. Unfortunately, our country is racked with a leadership crisis. We have to deal with the realities, for example, of bad decision-making of COVID-19 and rampant corruption, which are the result of poor executive leadership and ethics. It's very difficult for the mining sector to exercise control over what happens outside the sector. That is why it's so important to have good leadership within the sector, where a positive influence is possible. Solidarity regards this event as evidence of the Minerals Council leadership, and we commend them for it. But we also want to recognize the leadership shown by trade unions in mining and the DMRE with regard to health and safety. Come, let us all improve our leadership in order to improve our commitment to health and safety in mines, even amidst the COVID-19 pandemic. Remember, the most important thing to come out of a mine is a mine worker. I thank you.
Well, thanks very much for those words. And yeah, our objective ultimately is specifically focused on making sure that every mine worker returns unharmed and safe home every day in this particular process. So thank you for those words. Let me hand straight over to Frans Steering from UASA, and he's going to also video record of a couple of specific words from UASA. Thanks.
Good afternoon, Program Director and colleagues. Over the last number of years, it has become quite clear that an urgent paradigm shift is required from a reactive way of managing health and safety to a proactive behavioral-based culture and attitude within the mining South African industry. Let me start off with one of the fundamental principles of health and safety, and that it is everyone's business. I would even go further to say that prevention should be a way of living and a culture amongst all of us in the workplace. This event here today should not be deemed as merely another talk show or as window dressing, but should present proof that all involved do indeed regard health and safety as everyone's business. What we experience today involves a major paradigm shift from reactive health and safety strategies and attitudes towards a behavioral-based proactive culture amongst management and employees in the mining industry. Critically important, health and safety strategies emphasized here today, such as reporting unsafe working practices and to stop unsafe working practices without the fear of victimization, forms the basis for cultivating a sustainable risk management culture throughout the industry, empowering people to respond to activities appropriately and to enable them to predict, prevent, and control unsafe incidents and accidents. Continuous risk management is indeed an innovative approach in managing the health of our workforce. It further entails a shared visible process aimed at eliminating a risk behavior, creating a sustainable non-discriminatory practice. Some of our other very important key objectives involved in health and safety should be creating risk competence within the entire workforce, installing visible felt leadership as a value, recognizing and rewarding safety behavior and persons being proactive. Behavior-based safety is obvious, the next logical step in the process of continuous improvement and is an essential prerequisite for world-class performance. Health and safety should not only be about the reduction of incidents, injuries, and fatalities, but about the total elimination through proactive, non-risk-based behavior. It is also about the ability of management to influence and control the behavior of people. It is furthermore important to remember that health and safety can only be attained through teamwork, healthy employer-employee relations in the workplace, total commitment, and most importantly, by changing the behavior of people to benefit themselves. It is essential because the finance, health and safety campaign systems and equipment cannot function effectively if not correctly applied and monitored. And the most vigilant strategies will fail if not supported by aligned health and safety behavior and attitudes. Ladies and gentlemen, mining-related deaths have orphaned too many children, widowed too many women, and devastated too many families. And that is why we need many more initiatives such as this day within our industry. I want to close by quoting some words from our previous president, Mr. Nelson Mandela. He said, "My country is rich in minerals and gems that lays beneath its soils, but I always known that its greatest wealth is its people, finer and truer than the finest diamonds." You also wish to challenge all role players to stop sending out negative, distorted messages into the media and rather pledge its members' total commitment towards health and safety and towards the total elimination of discriminatory practices within the South African mining industry into the future. Under the current economic constraints, we owe it to South Africa and its Rainbow Nation to create a culture of tolerance and behavior-based safety, especially whilst managing the third wave we are currently experiencing. Thank you very much.
So Frans, thanks very much indeed for those direct words. And I think, again, when I think about the messaging that's come through from both the DMRE, from the Minerals Council, and from our union partners, and I say partners, we're not social, we're not stakeholders. We are partners in this journey towards zero harm. And I made exactly the same comment in last year's Minerals Council Safety and Health Day, which is we are partners in this journey together. What I would like to say to all of you is when you see the messaging coming through, what we need to be focusing on, the fact that this particular day is not meant to be just one day. It's actually a start of another 365-day cycle until we hold the next session about what we can do as leaders, as individuals, as people, as workers, to really drive the agenda towards zero harm and the step change that we believe we really embarked on through the Kumbuli Kaya strategy. So I want to say that from the Minerals Council side, we continue to commit ourselves to a continued process of leadership, collaboration, and engagement with our partners, from government, from the trade unions, and from other research institutes and others to help in the process, including the Mine Health and Safety Council, where the tripartite does engage, to make sure that we continue in this renewed focus on health and safety in the mining sector in the new normal. That's effectively what today is all about. So everyone's business is about what we do to improve health and safety in our industry, working together collaboratively. So I just want to take Temba's comment around the canoe. Yes, we are in this canoe together. I think that we are paddling in the right direction. We are paddling this canoe into the calmer water so that we can fix the holes and continue to improve our safety and health performance record. There's a lot that we've been learning along the way, and various organizations have contributed to that. Various structures like MOSH, the Mine Health and Safety Council, the Inspectorate itself, the trade unions, and the ideas that they've given us as partners in this particular process. So I certainly like the concept around proactive behavior-based, visible, felt leadership in the way that we tackle our safety and health challenges. And the commitment from the Minerals Council side is to continue to be focusing on the issues that are going to really significantly reduce fatalities and continue to make the sector safer, and a place where people want to work and live and be productive for their families, for the country, and for the nation. And I think the way that we've managed the COVID crisis so far really speaks volumes to that particular point. So my last point is just on the vaccine side. When the opportunity does come for vaccines, please don't think that not having a vaccine is a sensible thing to do. We all need to do what we can to achieve a community and nationwide immunity. And that's including influencing our family and friends about what they think and what they should do. And certainly in some of my conversations with some of my colleagues, some have said, no, well, I'm not sure about vaccines. Are they really effective, etc. The fact of the matter is that they are very, very effective in preventing serious illness. And that's what it's got to be, including continuing to practice all the right physical distancing, hygiene, and other controls that we know about, and which we've been implementing very effectively as the sector. So my last point is just to thank each and every single one of you for participating. One of the CEOs on the call said to me, he said, Roger, I'm really pleased that you didn't cut off anyone in this conversation, because this is what we do. We are focused on making sure that mining is a safe and healthy place to work. And as such, we can make this industry continue to be a significant, productive, and happy place for people to work in and contribute to the nation of South Africa. So to the Chief Inspector, to all our union colleagues and partners on the line, to all the mining company CEOs, the Minerals Council office bearers, and to the entire team, and to all the journalists that have stayed with us through this particular conversation, thank you very much for your participation and for your commitment to this critically important process that we continue to drive from a leadership perspective. So what I'd like to do is ask all the journalists that do want to stay on, and I'd like all those who've joined us to step off the call now, and thanks very much for your contribution, your participation, and for listening to us. Thank you, and keep safe.
Thank you. Keep well.
Thanks.
Thank you. Thank you. Well done, Roger.
Thanks very much. Thanks, sir.
Thanks, Roger.
Thank you, guys.
Bye.
See you, Roger. Thank you.
Thanks,
Thank
Roger.
you, everyone.
Well done.
Roger, nice to see you after a while.